and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the Living a Longer and Healthier Life show this evening. Tonight we're going to be talking a lot about virtual medicine. We have Ed Salazar here today from All County Healthcare Incorporated. allcountyhealthcare.com is the website as well. So I just want to talk a little bit about Ed before. You're going to recognize when you see him. He's been on the show numerous times. I want to say at least 5 times on my show. And he's like Superman. He swoops in and saves the day. No, really, in terms of health and for mankind. Ed is the head respiratory therapist at All County Healthcare. Serves the Tri-County area. Ed, and welcome to the program, Ed. Thank you
Good to be here again, Dave.
And so you're an experienced, super experienced respiratory therapist. Over 40 years, am I right saying that? And this, or more than that?
Yeah, I'll admit to it. No, I graduated from respiratory therapy school in '74.
Oh, wow. Okay. And how long have you been down in South Florida? A long time.
I graduated from Broward College.
Oh, okay. So you've been down here your whole career.
Pretty much, yep.
That's great. And so All County Healthcare is a home health care agency, but they do so much more. Last time we had you on, we talked a lot about your pulmonary team, as well as a lot of interpulmonary percussive devices that you guys use for COPD. Did I get that right? IPV?
Yes, you did.
Okay. But tonight we're going to talk about virtual medicine, and this is something I'm really excited about because it's been in the news. I mean, personally, I've kind of watched it develop, reading stories about it and whatnot. But it's one of those things, like, I kind of was waiting for it and was like, oh, it'd be great one day when we have it. And then seems like a delay for a little bit. You heard about that, and all of a sudden it kind of just hit the mainstream. I personally haven't used it. I'm going to the doctor more than ever as I get older. I imagine most people do. I'm learning that happens as you get to a certain age and take it to another level. But I've never used it personally, but I know some doctors who are into it and use it. Now, until I talked to you today, I didn't think of it at all for respiratory therapy, but as I did a little bit of research today on it, it's really used a lot. And this is the future of respiratory therapy and medicine, right?
Well, it's definitely going to be the future of medicine. This whole idea of getting involved with telemedicine, virtual medicine, remote patient monitoring, there are a lot of different handles that it gets. But it's just another effort by All County Healthcare to innovate. Mm-hmm. We were very innovative with our pulmonary hygiene team and the IPV, like you mentioned. That program continues to have outstanding outcomes. Now, we've had some very amazing success stories with some high acuity COPD patients. So what Mr. Biazzi has done now is we were contacted by a company. The company's name is Live Care, and they're based out of New York. And they showed us it's a pendant, mm-hmm. and we were just very, very impressed with the capabilities of this. Right now, there is a huge initiative by CMS to promote these remote patient monitoring, the telemedicine programs. It's just another way to move toward preventing hospitalizations. If there was a device that a patient could wear, and not only would it do fall detection, but if it also had GPS and it had a two-way audio-video communicator, so that the person presses, they're put in contact with either their home care agency or they're put in contact, with their physician, the physician assistant, and they can actually have a two-way conversation with video. I mean that would be pretty amazing, right?
Yeah, that seems so far off. But let me just go one thing you said. So it's a pendant that
It's a pendant that they wear around their neck.
That makes so much more sense than having a senior citizen or elderly holding up a tablet and trying to, because even with a tablet sometimes it's tough.
Sure, and
genius.
I'm pretty technology challenged, so I imagine
Me too.
what some of these patients have to deal with, when we're trying to get the total functionality out of these devices. What we're really excited about is that this particular platform we're looking at is going to be able to serve as a hub. And by a hub, I mean, like a central device that a lot of different devices can communicate with, without patients having to worry about, well, I've got to pair this, I've got to pair that. I have trouble, running my cell phone sometimes. But what they've done is they've come up with a platform which will allow many, many different types of devices. They will be able to monitor digital scales, a digital scale that has Wi-Fi capability, a SIM card, so that all the patient has to do is step on the scale in the morning, and it'll transmit the patient's weight that morning right to the physician's medical records. This is extremely useful in patients, say, with congestive heart failure, where any change, a couple pounds change weight overnight, might be an indicator that they might be leaning toward an event. So early warning is preventative medicine, right?
And that's because fluid may build up quickly, and that kind of thing. Wow.
Correct.
Never thought of that component aspect, but that is great news for the future of medicine.
Well, and let's go down the list. They have blood pressure cuffs that are also wireless and have Bluetooth capability. They have blood glucose manometers. Same thing. The patient can take their blood pressure as many times as they want during the day, and the readings will upload to their patient database. The glucometer, if the physician wants the blood glucose measured every morning, not a problem. And the physician can then look at the data at his convenience. They have a wireless pulse oximeter, the device that can measure how much oxygen there is in your blood and your heart rate. These things also can be, they can be monitored in real time, but at certain times measurements are taken, they can be uploaded to a database. So what will happen is the physician will have a dashboard on his computer with each patient, and he can look at all these parameters, and he can see trends over time. He can see the most recent tests, or in many cases they can look at it in real time. Now, what this can translate into, and it was originally thought to be, it was going to be most useful in rural areas, where it really is difficult for patients to get in to see physicians. What does a physician look at when you go into his office? They measure your height, they take your weight, they listen to your breath sounds, they do your blood pressure, they do oximetry. Okay, well, we can do all of that now right from the patient's home. And with the two-way video communicator, it's a virtual office visit.
That is so great, because the amount of info that the physician's going to get on almost day-to-day basis, maybe even you said several times a day, that's only going to help the patient in the long run, because the more information the physician has on record-wise, the more they can look into the outlying problems that are maybe affecting the body, the ailments.
And here's how it helps the insurance companies, Medicare, managed care, whatever. How many times does if a patient gets up in the middle of the night and then they don't feel well, they feel faint, they feel dizzy, so they go ahead and take their own blood pressure, they do their own glucometry, and a simple fix is recommended by the team monitoring. Okay, if this prevents a visit to the emergency room, that saves the insurance company a lot of money, and if it prevents an admission from the emergency room into the hospital, it saves that much more.
Yes, yeah, so this is a win-win.
That's the way this is going.
Win-win for the patient, for the doctor, and for the insurance companies. Wow, you don't get to say that sentence very often. And we have 17 viewers on Facebook Live, so if you have any questions, we'll be here till 6:30, or on the phone, it's 888-565-1470. You mentioned Mr. Biasi. I just want to reference, everyone who listens to this show would know Lou's been on many times. Lou Biasi, he's the Vice President of All County Healthcare, and we're here with Ed Salazar, lead respiratory therapist at All County Healthcare, 1-888-717-7170, or allcountyhealthcare.com, as well as on Facebook. So virtual medicine is what we're talking about. I've never used it as a patient. Have you?
No, I haven't.
Okay. I'm looking forward to it, just hearing what you have to say. Like you really make it really is an amazing tool.
Well, let me tell you, we're not quite ready to go live with it. They're working out some details, in the platform, the back end where the monitoring is being done, and the data stored and released. Now they will archive this information so that the physicians will actually have an archive to document that they are monitoring the patients, times, duration, everything.
That's great.
But some of those details are still being ironed out. But we will be going live with this in the very near future, and we're very, very excited.
So that's All County Healthcare is going to have virtual medicine in the near future, and your company is at the forefront here, because with the COPD talked for years. I know people are still just finding out about it. I mean, you've done so much leeway in the state of Florida with COPD treatment with the IPV machine, intrapulmonary percussive device. We had it on the show here once, and it was amazing. I could really feel it. But you guys are at the forefront again, because I know healthcare companies are getting into virtual medicine, but a lot of them, it takes time, like you just said, building the platform and the logistics of it. But again, you guys are at the forefront. It's like you're always out there finding the next thing to bring your patients. That's great.
Well, that's what Mr. Biasi wants. He wants to stay ahead of the curve. And we've been fortunate that we've have physicians that are also, looking for this type of innovation that we can, partner with.
Oh, yeah, because you have to have them buy in.
Oh, yeah, they've got to order it.
Yeah, definitely. That's a good point. Again, we're here with Ed Salazar, allcountyhealthcare.com. We'll do one more question, take a quick break. So I want to ask you, and we can go into this a little bit deeper after the break, but respiratory-wise, this has been a trend. I know last year the American Association for Respiratory Care published an article on this, very extensive article. If you have a chance to check it out, it's aarc.org. So for respiratory issues, if we can localize that, we talked a lot about heart and weight and things that happen. But from a respiratory therapist standpoint, how can virtual medicine help?
Well, a lot of your listeners, I'm sure, are CPAP users. Most
right here. I've shared it. They know.
It's
April 1st.
Most of the new platforms that have come out for CPAP machines also have Bluetooth or Wi-Fi capability. So again, data can be reported in real time, or it can be a stored event, and the physician who prescribed the CPAP can follow up on his patients to be sure, number one, they're using it, number one, that they are compliant.
That's important.
And number two, that it's getting the desired effect.
Definitely. Well, let's take a quick break. Hard to believe 15 minutes through, but on the other side, we'll talk a little bit about virtual medicine on the Living a Longer and Healthier Life show.
All All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond. Welcome back to the Living a Longer and Healthier Life show. We're here with Ed Salazar, lead respiratory therapist at All County Healthcare. It's allcountyhealthcare.com as well. So we're talking virtual medicine. It's like the future is here. I mean, we always have doctors on here, surgeons. I mean, we talk a lot about robotic surgery and these interventional procedures in neurology and cardiology, and just hearing about them. I remember it wasn't too long ago where there was open heart surgeries or they had to do to open the skull to get to it. Now they're going intravenously, and now we're using telemedicine, we're using virtual medicine, we're using technology. I mean, technology has grown so much in healthcare over the last few years, but this is great news. So obviously, though, doctors working with All County Healthcare, once this is set up, the virtual medicine portal, will be using this, but do you think as a lead respiratory therapist, this is something that you'll be possibly trained on and be able to, give people your expertise and knowledge through the portal of a laptop or any of those devices?
We definitely are going to embrace this and roll with it. As far as making it user friendly.
Mm-hmm.
One of the big problems that so many senior citizens have is say, okay, well, you got your cell phone, you got to plug that in every night to recharge the battery. Well, now are you going to tell them, well, I want you to charge in your monitor every night and your glucometer and your no, we don't want to do any of that. What they've done is they've taken it one step further, and this pendant that we're talking about, it actually has a wireless charger. So all the patient has to do is to take their pendant and just set it on top of the charger, and it will recharge.
Okay, it's that technology we kind of seen with cell phones. Some of the companies have that.
Thing.
Right. You just lay it on there, and I guess it charges it. Well, that's great because that's you don't want the user to have a lot of difficulty.
Yeah, you don't want to create any distress. You don't want any anxiety.
Uh-huh.
You want to make it as simple as possible for them. And once they turn it on, it links to all the other devices that are being monitored, all the different parameters that are being monitored. They do have to push the button to to get their blood pressure, and they do have to do their glucometry. But delivering the data will be done automatically.
Yeah, but people learn, with devices. Look at us on our cell phones. The way cell phones have evolved. And as well, this is a great idea with the pen, and that's the first thing I really liked about it. And thinking back, I remember that it's almost archaic now. I know it still uses that life call device, the big one in the late 80s, early 90s that came out, and it was just the button. Right. Almost like a garage door opener, but it was white with the big button. And now how it's evolved to this, and a few years ago the Fitbit was the trend, I had one until it broke, and I loved it. And I just learned to use it and all the different features. But now this has evolved so much into the pendant and how the information's being shared.
That's another device that could be incorporated into this program.
Yeah, because I know people love their Fitbits. I definitely want to get another one. I mean, it was competitive. You could compete with people online that you didn't even know how many steps. I was trying to get steps.
Right.
I went from like 2,000 steps a day to like 27,000 steps
There
one
you
day
go.
when I went
There
to
you go.
Disney World and I was chasing my daughter around. So it's definitely changed so much. And I'm so happy that you guys brought this here today in this info because, like I said, you guys are always at the edge of what's next. Again, it's allcountyhealthcare.com. They're looking into virtual medicine, so stay tuned. And we're here with Ed Salazar. He's the lead respiratory therapist at All County Healthcare, 40 years of experience in South Florida as well. Do you think, just your opinion, I'm putting you kind of on the spot here, bedside manner-wise and the consultation, doctors are going to have to be trained on this type of device a little bit, but do you think that'll be lost at all, like the way we're talking right here? It hasn't been lost. Like I know iPhone has the FaceTime app, and that until I used it, I never understood it, but it works really well, and you don't lose the interaction that we have here.
Well, I think what it'll do is it'll improve accessibility. You know, how many hours can a doctor keep in his office? Well, if he has staff members who are available for patients, you know, around the clock, the company that produces the pendant, they also have a monitoring service. You know, if they chose. Could I just see that brochure again?
Oh
please?
yeah, definitely.
Okay, what LiveCare is offering is that emergency response. You know, these can all be monitored by a monitoring agency. So as I said before, the physician they establish parameters. Okay, I want my patient's blood pressure to be in this range. You know, I don't want their blood oxygen levels to go below this point. You know, if they go outside of any of these parameters, if their morning glucose reading is above such and such, then they want to be contacted. Okay, so this actually, you know, it improves the physician's accessibility. As far as losing that personal touch, I mean, this isn't going to replace office visits entirely. But what it'll do is I believe, that it's going to do an awful lot to fill the void between those visits. And, you know, that's when, you know, the patient's anxiety can build up. You know, sometimes all someone needs to prevent them going to the emergency room is just a little assurance. You know, it's a voice that is telling them, look, I'm looking at it and I don't see a problem. You know, let's relax, you know, let's take your medication, whatever it might be, drink some orange juice, and we'll check it again and see how it goes.
That's a great point because, yeah, if there's no reason to, you know, go to the emergency room and clog up the emergency rooms, you know, it's something that can be just a conversation. Someone was scared about an issue and they got to talk to the doctor and listen to the doctor was like the parameters, you know.
If the doctor on call has nothing to look at, you know, thanks to lawyers, what choice does he have?
Yeah.
But to say, well, I guess you better go to the emergency room. Well, you know, perhaps that will become a thing of the past as well.
Nice. This is a great. It gives the patient options. It gives the doctor options. It gives the insurance companies options. Let me ask you. I'll put you on the spot again. Virtual respiratory therapist. So when I was doing all this research reading, this thing popped up somehow. We got 2 minutes left. Somehow a keyword or something I may have Googled or something, and a virtual respiratory therapist ad popped up, and it had the amount of salary per year. And it was pretty impressive for virtual. Do you think we'll see virtual respiratory therapists in the near future?
Well, here's what we have right now, and we will see more of in the near future. We have life support devices, ventilators, that have this capability to interface with these monitoring systems. The very near future, you are going to see more extensive, more high acuity capabilities, ventilator dependent patients and such. It's going to be an exciting time.
That's great. And again, it's allcountyhealthcare.com. They're looking into virtual medicine. They're actually working on it with a company named LiveCare. So that's great news. They brought us COPD treatment in the form of interpulmonary percussive devices, which is great to break up the congestion from COPD. If you have any questions, it's allcountyhealthcare.com or 1-888-717-7170. It's a great website. You can follow them on Facebook as well. They put up a ton of information. And Ed has some studies there on the website as well you may want to check out. They're on COPD. He works very hard for the company. If you have any questions, ask for Ed. Again, 888-717-7170. Ed, you always bring the latest and greatest in health. I mean, you really do to the
It's
show.
always a pleasure to be here.
Thank you, and we'll see you next time on the Living a Longer and Healthier Life show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.